Hi everyone, my name is Yiting Liao. I'm from Taipei Medical University. In this PBL talk show, we're going to discuss cervical cancer. And here is the situation. We can see a 27-year-old woman presented with increased vaginal bleeding, left leg swelling, and abdominal pain. With examination, doctors found a large fixed pelvic mass. In order to better diagnose the syndrome, we dive deeper, observing the scan evaluation. Computed tomography, as known as CT, shows that she has hydronephrosis. Pathologic examination showed an adenosquamous carcinoma. After considering all the clinical presentations, we conclude that it is cervical cancer. Now we elaborate on some common clinical presentations of cervical cancer. First is unusual vaginal bleeding, particularly after having sex, and there might be vaginal discharge and odor. In early stage disease, pelvic pain can be observed. In later stages, back pain or disrupted urination or defecation may occur. Advanced cases may present with lower extremity edema or renal failure. There may be little or no obvious cervical lesion in early stages, but in more advanced cases may have large, bulky, friable lesions, encompassing majority of vagina. From the book of Ferris Clinical Advisor 2021, the definition of cervical cancer is the penetration of the basement membrane and infiltration of the stroma of the uterine cervix by malignant cells. Physical examination that doctors may take in laboratory tests are below. First is complete blood count, as known as CBC, which is a group of tests that evaluate the cells that circulate in the blood, including red blood cells, white blood cells, and platelets. The CBC can evaluate your overall health and detect a variety of diseases and conditions. Next is squamous cell carcinoma antigen, abbreviated as SCC antigen, which is the first commercially available tumor marker for squamous cancer. The third is carcinoembryonic antigen, CEA, which is a protein normally found in very low levels in the blood of adults. The CEA blood level may be increased in certain types of cancer. In imaging study, doctors would check the chest X-ray. A chest X-ray is done to see if there are any changes in your lungs. This may show that cervical cancer has spread. Another is intravenous pyelogram, abbreviated as IVP, is an X-ray examination of the kidneys, ureters, and urinary bladder that uses iodinated contrast material injected into veins. Depending on the stage, doctors may need to check the CT scan, MRI, or PET-CT. PET-CT stands for positron emission tomography computed tomography. It is a type of nuclear medicine imaging. Nuclear medicine imaging uses small amounts of radioactive material to diagnose, evaluate, or treat a variety of diseases. Other examinations include pelvic examination with careful rectovaginal examination. On pelvic examination, the cervix may be ulcerative or exophytic. It usually bleeds on palpation, and there is often an associated serous, purulent, or bloody discharge. The lesion may involve the adjacent vagina and extend toward the introitus. Now let's talk about how do we treat cervical cancer after diagnosis. In general, it all depends on timely evaluation and treatment. Therapy is based on the stage of the disease. Radical surgery, radiotherapy, and chemotherapy are the most common treatments. Radical surgery is used for select patients with stages 1 and 2 disease. Radiotherapy, including brachytherapy and teletherapy, is used for stages 1B and 2A disease or greater. Brachytherapy is a form of radiotherapy where a sealed radiation source is placed inside or next to the area requiring treatment. In fact, post-operative radiotherapy can reduce the risk of recurrence by almost 50%. Be aware that chemotherapy does not produce long-term cures, but response rates of up to 50% have been obtained with multi-agent combinations. For example, the combination of cisplatin, doxorubicin, and etoposide. Persistent infection with high-risk HPV has been identified as the essential factor in the pathogenesis of the majority of cervical cancers. The virus' ability to transform human epithelium has been associated with the expression of two viral gene products, E6 and E7, which interact with P53, a tumor suppressor protein, and retinoblastoma protein, PRB, respectively, and affect control mechanisms of all the cell cycle. There are some risk factors associated with cervical cancer, such as smoking, early age of coitarche, having multiple sexual partners, infection with high-risk human papilloma virus, contraception, multiparity, or when you're at an immunocompromised state. Now let's see some of the findings from the book of the occurrence of disease in ClinicalKey students. According to the finding, almost all cancers of the cervix are carcinomas. 85% to 90% are squamous carcinoma, and 10% to 15% are adenocarcinoma. The chart below shows the trends in age-standardized cervical cancer mortality rates, uncorrected and corrected for the prevalence of hysterectomy from 2000 year to 2012 for white and black women. The estimated age-standardized incidence of cervical cancer was 13.1 per 100,000 women globally and varied widely among countries, with rates ranging from less than 2 to 75 per 100,000 women. It is certainly the leading cause of cancer-related death in women in Eastern, Western, Middle, and Southern Africa. This is the comparison of survival in different stages, executed by the International Federation of Gynecology and Obstetrics stage. We can see the survival rate declined as the stages increased. By the way, mass-controlled studies have demonstrated that identical survivals for pregnant and non-pregnant patients. In order to make this more interesting and more like a PBL, I created some virtual characters to discuss with me. First is Dr. John Doe. He said, nearly all reports show early detection and treatment prevents 80% to 90% of invasive cervical cancers and has greatly reduced cervical cancer mortality. Dr. Jana Jan said, a study indicates that a single screen using testing for HPV in cervical cells or visual inspection of the cervix after swabbing with acetic acid is a cheap and effective way to reduce a woman's lifetime risk by 25% to 36%. Dr. Daniel said, Type 16 and 18 HPV caused most cervical cancer worldwide, and effective vaccines are now available. 2 rounds of screening at 35 and 40 years could reduce lifetime risk by a further 40%. My conclusion is, if screening were introduced across the developing world, then the global incidence of cervical cancer could fall by about 50%. Ideally, all young women should be vaccinated against HPV with modern, effective, quadrivalent vaccines. This would virtually eliminate cervical cancer and the need for screening. Thank you for listening. I hope you know more about cervical cancer.